Hi guys, today we'll talk about what is hemostasis is nothing but arrest of bleeding. Whenever an injury occurs, the bleeding has to be stopped after a while. So what are the steps that occur inside the body to stop that bleeding? So there are three steps. One is vasoconstriction. Diameter of the blood vessel is reduced. Two, platelet plug formation, but this is temporary step. Third is the definitive clot formation, that is clotting mechanism. And whenever there was an injury, now the exposure of collagen occurs with the damage of the endothelium, and this causes the adherence. The platelets adhere to the exposed collagen, and this whenever they adhere to the collagen, they will get activated, and these activated platelets will secrete serotonin, which acts as a vasoconstrictor. The first step, vasoconstrictor. At the same time, the platelets also secrete ADP, thromboxane A2, which are aggregators of platelets. So that causes aggregation of platelets. So once the platelets are aggregated, we call that as platelet. And then the third step, that is the clotting mechanism, the formation of prothrombin activate. Now we'll see individual step. Vasoconstriction, as we already mentioned, it is serotonin of platelets. Also by the local myogenic response vessel. Whenever the injury occurs, the local smooth muscle will undergo constriction, and the serotonin, which is the vasoconstrictor. Coming to the platelet plug formation. So it is the primary hemostatic plug formation, and we know the three steps. A for adherence, so exposed collagen binds to, and once the platelet binds to that, it gets activated, activation, and the activated platelet will release ADP, thromboxane A2, and which causes aggregation, adherence, activation, aggregation. The three steps required for the formation of platelet, and the duration that occurs from the point of injury to the platelet plug formation, we call that as bleeding time. And now the definitive clot formation, the clotting mechanism, and it has three steps. One is formation of prothrombin activator. So first, we require a prothrombin activator. What it is activating? It's activating prothrombin to thrombin. Now what happens? Thrombin will help in the formation of fibrin clot. So this can be explained by enzyme cascade theory. Before going to that, we have to know the clotting factors. There are almost 13 clotting factors numbered, but only 12 clotting factors exist with no clotting factor. So factor 1 is called as fibrinogen, factor 2 is called as prothrombin, factor 3 is called as tissue factor, and this is the factor or thromboplastin, the factor for extrinsic. And factor 4, that is the calcium. Factor 5 is heat labile factor or proaccelerin. Factor 6 is abscess, and factor 7 is stable factor. Factor 8 is anti-hemophilic factor. Factor 9 is factor. Factor 10 is Stewart power. Factor 11 is TT, plasma thromboplastin antioxidant. And factor 12, that is the contact factor or the H-man factor, and this is the starting factor for intrinsic mechanism blood clot. Now we'll go with the steps, and factor 13 is the fibrin stabilizing factor or fibrinase. So first step in the clotting mechanism is formation of prothrombin activate. Now it occurs by one, intrinsic mechanism, and two, by extrinsic. Prothrombin activator can be formed either by intrinsic or by extrinsic. So when intrinsic mechanism occurs, whenever there is an injury for blood vessel. When extrinsic mechanism, whenever there is a tissue trauma. Now the sequence steps. You already know that the factor 12 is called as contact factor or Hageman's. So whenever the blood vessel is injured, the collagen is exposed. The 12, that is the contact factor, will be activated to 12A, and this 12A will convert the 11 to 11A, and this will activate 9 to 9A, and this 9A will activate 10 to 10A, and our step is this 10A, which is part of prothrombin activation. And by the tissue trauma, the factor 3 is activated, which is factor 3 converted to 3, and this will convert 7 to 7A, acts over 10 to form 10A. So our step of 10A formation with the help of factor 5 and phospholipids 3 together, we call that as prothrombin activate. So now we got the prothrombin activate. What this prothrombin activator will do? It will activate 2A, but prothrombin to thrombin. What this 2A will do? Will activate 1 to 1A, that is nothing but fibrinogen to fibrin monomer. So, and this 1A is stabilized by factor 30. These are the steps in the clotting mechanism. I can see that in the diagram. Whenever there is a blood vessel injury or collagen exposure, 12 is converted to 12A, and that acts over 11 to 11A, and 9 to 9A, and calcium acts as a factor. You can see here thrombin here, so that's a positive feedback mechanism. Once the thrombin forms, it can catalyze its all the steps previous to it, or it can activate itself, prothrombin to thrombin. You can see that here also. T is for thrombin. Now the 8A will activate 10 to 10A, and the 7A will activate 10 to 10A in the presence of platelet phospholipids. And now factor 10A and factor 5 will together convert the 2 to 2A, that is thrombin. Thrombin will convert fibrinogen to fibrin, and this factor 13 will stabilize fibrin monomer to form fibrin polymer, that is fibrin mesh, the clotting mechanism. And clot retraction. After about 30 to 45 minutes, the clot will be retracted. So the injured vessel, the two ends which are holded by the clot are retracted by the help of platelets with the contractile proteins actin, myosin, thrombasthinin. And when the clot retracts, serum oozes. And coming to the, clot is formed and the vessel is healed. Now the clot has to be lysed. So for the lysis, we require plasmin, and for the plasmin will be formed from plasminogen. We'll see the steps in the next. And why fibrinolysis occur? As we said, it is a normal healing process. 2. Menstrual clot. Usually the menstrual blood immediately after oozing out from the uterus will undergo clotting, but the passage of clots outside is different, so it has to be lysed. So fibrinolysis occurs, and the menstrual bleed occurs as in and semen liquefaction. When the semen is ejaculated, it bonds to the walls of the cervix so that it don't get washed out, and after some time the semen has to get liquefied so that sperm moves towards the uterus. So what are the steps? Whenever a tissue is damaged or the endothelium will release a product called as thrombomodulin. This thrombomodulin with the help of thrombin together forms thrombomodulin and thrombin complex, which will activate protein, and this activated protein C, the presence of protein S, will inactivate 5 and 8. At the same time, it also inactivates the tissue plasminogen activator inhibitor. That's a double negative. So activation of tissue plasminogen activator occurs, and also the damaged tissue will release lysosomal enzymes, and both together, plasminogen activator and the lysosomal enzyme, will cause the activation of plasminogen to plasmin. This plasmin will cause the breakage of the bonds between the fibrin threads, and that causes lysis of clot. And there is a one question: why circulating blood is not clot? One, velocity of the blood. So if the velocity of the blood is slowed down, like a bedridden patient for a long duration, there is every chance of formation of deep vein thrombosis, clots in the veins. So velocity of the blood should be maintained. And smooth endothelium. The endothelium is roughened, the 12 will be activated, so endothelium will be smooth, and so no activation of 12. Circulating anticoagulants like heparin, antithrombin 3, and proteins, and fibrinolytic mechanism. When those minor clots forms, immediately they will be lysed by the fibrinolytic mechanism. And even some clotting factors are activated, they are removed by the liver. And prostacyclin is the one which prevents the thrombosis in A2 form. So these are the steps which prevent the clot formation in a normal circulating blood. And coming to the anticoagulants. So anticoagulants can be classified where they can be used. Vivo. The body. Heparin and coumarin derivatives can be taken in or can be injected. And both EDTA, even heparin can be given in vivo and in vitro, that's for the lab purpose, oxalates and citrate. And there are physical methods like cold temperature 5 degrees centigrade or smooth coated bottles, which are nothing but silicon coated bottles, prevent the activation of the physical method. Now coming to the heparin. Heparin is secreted by mast cell and both vivo, and heparin has three mechanism of actions. One, it suppresses thrombin. Two, activates 9, 10, 11, 12 factors. 3, it activates antithrombin 3. So this antithrombin 3 will remove thrombin and there will be no blood clot. And uses. Heparin, as we said, can be used in vivo and in vitro. So one is dialysis. During dialysis, the blood has to come out and pass through a machine and again back into the body. Meanwhile, it should not get clotted. So heparin will be added. Heart-lung mission is the function, and as a treatment for deep vein thrombosis. Coumarin derivatives are nothing but warfarin and dicamerol, which are vitamin K antagonists. And vitamin K dependent factors are 2, 7, 9, 10. So if vitamin K is not there, these factors are not possible. And it can be given oral route and uses myocardial infarction, strokes, and in thrombosis as a treatment. And ethylenamine tetraestic acid, diamine tetraestic acid, both vivo and in vitro, and it absorbs the calcium. So calcium is the important cofactor for clotting mechanism. If calcium is not available, clotting won't occur. And it is given IV, intravenous. Oxalates and citrates forms calcium salts, calcium oxalate, and calcium. Calcium is not available for the clotting. Thank you for your patience.